So, good afternoon and good morning to everyone. I'm Chris Humphrey, the Executive Director of the EU-ASEAN Business Council. Welcome to the second of our COVID-19 related webinars, today looking at anti-illicit trade. And I'm very pleased today to introduce Lena Verstiger. She is the chairwoman of our anti-illicit trade working group at the Business Council, and she will be moderating today's session. So with that, I'm going to pass controls over to Lena now, and then she'll be taking it forward from here. So thanks, Lena.
I'm just seeing if I to do anything in particular.
No, you should be okay. All yours now.
Oh, mine now? Okay, okay, great. Thank you so much, Chris. Thank you to the Business Council, to the Business Council team as well for organizing this webinar, and also for inviting me to moderate the session. It's a pleasure to be here today. So as Chris mentioned, I chair anti-illicit trade with the Council, and in my day job, I had anti-illicit trade prevention external engagement for the Asia region for PMI. So good morning to everyone, and like Chris said, good afternoon as well, depending on where you're dialing in from. So before entering into the heart of the topic, I would just like to do a little bit of housekeeping. So the webinar today will last just over an hour. We're going to start by having a panel discussion with distinguished panelists, and following that, there will be a Q&A session. So if you have any questions, please bring in a lot of questions. You just need to use the Q&A function on Zoom, so you can address your question there. If it's addressed to someone in particular, just let me know who it is, and I'll ask the question for you. And alternatively, what we can do is that you can also just raise your hand, and I'll unmute you so you can ask your question. And also, this is the first time I'm doing this, so hopefully I'll be able to find and ask your questions. So, the Council ran actually first webinar last week around the series around COVID-19, and last week it was on disruption in supply chains. So, you know, governments want and are working towards keeping trade flows open, and particularly for essential goods. But what we've been seeing and what we discussed in the panel last week is that there are big issues regarding to supply chains. Here that the major disruptions for the legal, for the illicit industry, we're seeing impact on sourcing, on manufacturing, on movement of goods in general. So what we want to discuss today is what's going on in the illegal trade. Are they also going through these types of disruptions as well? So we're going to explore that in the webinar. So across the world, we're seeing crime stepping up and really taking advantage of the situation, as it was to be expected in so many different ways. I'm sure you've been seeing in media situations where they're selling fake face masks. There are a number of websites popping up which are allegedly selling chloroquine, online retailers selling counterfeit hand sanitizers. I mean, just recently, U.S. Customs and Border Protection seized its first package of fake COVID-19 test kits. I mean, I could go on and on with these type of examples. We're also seeing that, you know, the lockdowns across the globe, more and more people are staying at home. So that just means spending more time online. And as a consequence, of course, we're seeing a proliferation of illicit on e-commerce platforms. So also, on the other hand, we're seeing that a number of organizations and governments are taking important steps to address these issues early on. Like we've seen WCO, just to give some examples, has launched a group for data exchange on counterfeit medical supplies and fake medicine. We've seen that Interpol issued international guidelines to support law enforcement to respond to COVID-19, or OLAF in the European Union that's launched an inquiry into fake COVID-19 related products, and so on. So on the other hand, something we're hoping to see as well is that we've seen cases, for example, in Latin America as well, where organized crime is actually also being disrupted due to these lockdowns. So to discuss all of this and have an idea of what we're facing in the ASEAN region, to explore what governments are doing, what governments maybe are not doing, what can they do, we put together a really very seasoned and diverse panel today, which I'm going to introduce to you now. I'll start off with Ramesh Raj. So Ramesh is the regional manager for Asia Pacific at the Pharmaceutical Security Institute. Raj comes with 20 years experience in Singapore Police Force and also Singapore Health Authority. He has a deep understanding in the areas of criminal intelligence gathering and investigation. Our second panelist is Dr. Patrick Kos. He is head of legal and compliance in Asia Pacific for Roche International. Patrick is responsible for all legal, sustainability-related matters and compliance. He comes with over 20 years of experience across the globe in law, technology, data, and business. We have Ms. Angelia Chu, who's founder and managing partner at AC Trade Advisory. She as well comes with 2 decades of experience, but in the area of trade and customs. She's a former partner at KPMG and also had the responsibility for trade and customs globally at Philips Electronics. Last but certainly not least, we have Paul Kelleher, who is the Corporate Relations Director for Asia Pacific at Diageo, where he manages the company's external affairs agenda all across the region. He comes with a decade of experience in the region, both in the private and the public sector, having formerly worked for the European Union. So welcome to the panelists. I'm really happy to have you here. I know most of you personally, so this will just make it even more enjoyable session. So to kick off, to set the scene, to kick off the conversation, I'll start by asking the first question to Ramesh. So Ramesh, taking advantage of your law enforcement background as well, to ask you to give us a sense on why there's been an increasing amount of falsified medicines being manufactured in the ASEAN region. So here I'm talking also pre-COVID-19. All to you, Ramesh. You just have to unmute.
Right. Okay. I hope everyone can hear me. A very good afternoon, and thank you, Chris, for inviting me, and a very good, well-established list of panelists for this afternoon. Lena, it's a very interesting question. It's a very difficult question, but I would definitely want to take a very diplomatic approach in hitting it right now. As you may or may not know, 4 of the 10 busiest air routes are actually between ASEAN member states. These routes are very complex, and at any point in time, criminal syndicates can come into the supply chain from the time where the medicine is in the state of production until the time where it is the distribution to the pharmacists, to the private clinics, and even to hospitals. It depends on which country you're looking at. So it is a very diversified supply chain. It's a very complex trade route here we are talking about, and culprits actually do apply a very complicated manufacturing process as well. This ranges anything from carrying small-scale manufacturers at the backyard to and even towards a more sophisticated factory production operations as well. So it all depends again on which country and which region you're coming out from. More specifically, if you're talking about Asia, Asia is a culture of self-medication, especially among migrant population who aren't able to easily get access to medication. And this is something that PSI works towards as well with our members and our other law enforcement partners. But having said that, this situation also poses as a potential catalyst for counterfeiters to come into the business and discredit the supply chain. But if you actually think about it, this is in fact a perfect crime. Why do I say this? If a patient actually dies having consumed counterfeit cancer medication, there is no medical report or there is no doctor would come out to say that the patient in fact did die out of having consumed counterfeit medication. So there is no correlation towards how the person dies versus how the counterfeit medication was introduced to the patient as well. And adding on to that, Asia is relatively more broadband penetrated as well. And this promotes more online activities. Say, for example, the post-COVID era, right? We'll see a continued use of people using technology to see doctors, like what we have already started in Singapore, like telemedicine as well. And at some point in time, this will in fact promote patients, easy access for patients to get their hands on medications versus how it's being traditionally done. Meaning you go and see a doctor, you get a prescription, from the prescription you go to a pharmacist and you get the medication. So it's a lot of work that's in progress, but I don't think that this problem is only confined to Asia. PSI runs a lot of programs, a lot of enforcement efforts out of Latin America as well, and we do see some trends across the world, across the global problem. But of course, in Asia, it's a lot more fast moving because of how dynamic it is. Yeah, that would be my take.
Oh, thank you very much, Ramesh. I see that there's already a raised hand, but maybe I'll go over the first questions to all of the panelists, and then open up the mic for the first question. So my second question, I'll address it to Patrick. So similarly, Patrick, just to have just to like what I've asked just now to Ramesh, but more from a company's perspective, from Roche experience, could you also give us your views on an outline of why there's a wide range of falsified medicine which are detected in this part of the world, in this region, and also explain to the audience what are the dangers of buying unregulated pharmaceuticals online?
Right. Thank you, Lena, and thank you, Chris, for having me. Very good question, and Ramesh, it was very interesting to hear from your perspective as well. So maybe to add on to this, Southeast Asia is a huge market, and it's very easy to tap in for non-prescription drugs. For prescription drugs, it's a little bit different, but for non-prescription drugs, it's very easy to enter the market. The purchase power of the people in Southeast Asia in general is much less than in more developed countries. So they are desperate for products, and they are probably more inclined to spend some money if they can't get this products into a certain market. So for the counterfeiters, it's easy to make a huge profit margin on the products. They produce them cheaply in somewhere, as you said, Ramesh, in a backyard, somewhere in India, in Bangladesh, in China, and then it's easy to distribute over the internet. You have access to a huge market. There's not so much controls. So for the OTC products, over-the-counter products, it's quite easy to get into this market. Particularly, as you mentioned as well, the online activity is probably more developed in other areas in the world. From a prescription drug standpoint, we see less of counterfeiting products, mainly probably because these products are distributed or administered by doctors and nurses. So there's already a certain filter that you don't get the wrong products to the patient. If patients are desperate because the drugs are not available in the market, they look for other sources, and then they're inclined to get the product. If they're desperate about to die, they try whatever they can, and they try to buy whatever it looks, it's fine. Even for me as a Roche employee, it's hard to detect a product if it's counterfeited or not. They're so sophisticated by now. 10 years ago it was different. You can distinguish by the color and the writing, you could tell, but now it's very hard to find it. So probably an additional reason, there's I mentioned no healthcare coverage in most countries. So people try to find it through the back doors of cheaper medications. Online it's usually cheaper, but they don't really know what to get. So to answer the second question, what's the danger of it? In the best case, there's no harm because it's either the active ingredient is diluted, or maybe it's harmless. Might be just sugar or flour. The worst case, it can kill people. There's an estimate about 1 million people per year die because of falsified medication. So this is the big danger generally. What we've seen for the very harmful products, some of our products, there was wastewater, so sewage water, and you know this is going to be infused. So there's no scruple for the people who are doing this. They don't really care. It's just about the money.
And when you mentioned in the case, Patrick, where you have people actually ingesting medicine where maybe it won't do any harm to them, but there's also the case that the fact that they're not being cured, what they're supposed to be cured.
Right.
Yeah.
Yes. So I said for cancer medication, we see less of this, but for our older products, you buy something, spend money, and there's no effect in the best case. And the worst case is detrimental, and you get even sicker.
Yeah, very interesting. Thank you, Patrick. I'll turn over now to Paul, turning to another sector, to the alcohol sector. Paul, from your experience, could you tell us a little bit about the issues you've been facing in the last years, so even pre-COVID-19 in Southeast Asia relating to counterfeit alcohol, and similarly explain what are the dangers of buying these unregulated products online or in markets?
Yeah, sure. Thanks, Lena, and thanks, Chris, for setting this up. Actually, some similar themes, right, that are going to play out here that Ramesh and Patrick have also talked about. I guess the first reason why, because there is an incentive to do it right now, right? And we'll talk a little bit about the tax and availability regulatory structures which set that up. And the other reason is because there's high demand. So first of all, when we think about illicit alcohol, I guess it's important to understand, what form that can take, right? So there's counterfeit, there is non-conforming alcohol. Both of these can have serious health implications. And then there's smuggling, tax leakage, which can be legitimate products that are brought in over borders not paying tax. And then there's community alcohol, which is in some instances across Southeast Asia, although there is some cultural and religious sensitivity around alcohol. Alcohol has actually formed a part of religious and ritual cultures dating back some time. So you kind of need to pick all of them apart. What I would say, though, is the increased risk in terms of things that are seriously injurious to health. Again, it's looking at the framework through which alcohol is regulated in the region. So some of the highest excise tax rates, some of the highest import duty rates within the region, and some very, particularly in the COVID world as well, severe restrictions on availability of alcohol. If we think of generally on-trade being bars and restaurants, off-trade being liquor stores, a country like Indonesia, although 84% Muslim, that 16% still accounts for 40% non-Muslims. So there's a big population there who are interested in consuming alcohol of various forms, but there's a distinct lack of availability of legitimate alcohol, increasingly high taxes, so that drives a massive incentive for illicit trade. And the final thing I'll say about it is what we've seen, and where I think there is an increasing challenge for us, is around communication of the dangers of illicit alcohol. So there was a study a few years ago done with the University of Indonesia, looking at what in Indonesia is called oplosan, which is illicit alcohol. So it's concoctions of methanol plus mosquito coil plus all sorts of terrible things mixed together. And people are consuming that. Again, there's a lot more that we can do as a private sector, as government as well, to talk about some of the challenges and health implications. And I guess we'll come on later on to the COVID piece. But of course, this kind of issues already put more stress on a healthcare system that's already under pressure. To the second part of your question on alcohol sales online. Look, I would say that we're working hard as an industry through the International Alliance for Responsible Drinking to work with the likes of Facebook, Snapchat, Instagram to have clear guidance on how alcohol can be sold. In theory, we want to have an online shelf being as safe as an offline shelf, right? With the right 2 or 3 step verification process, age verification processes as well. And I think that's something the industry is working hard to do. The problem, and it's heightened at a time like this, is you've got people who will get quite entrepreneurial, right? And you'll see it on Facebook. They'll put up pages, they'll link information to phone numbers or to email addresses without actually displaying images per se. And that's something I think we need to work harder with some of the e-platforms and regulators to be able to tackle. But it is something we're seeing an increasing challenge as e-commerce becomes a platform for alcohol availability across the region.
And then in that sense, just to follow up on this is quite interesting. So you have the availability of these illicit sales online. How are they mostly coming in and moving? Is it through small packages generally, or is it orders within the countries? Is it going cross-border? How, just generally in this part of the world?
It's a combination of both. I would say, right? So they are, most of these operators are relatively small scale. So it is coming in across other borders from free trade zones and from elsewhere. And the challenge that you have is that they're quite small, they're quite agile, they're quite nimble, unlike a lot of our companies and people who are on the line now. So they're constantly reinventing themselves, looking at new platforms, on an almost daily or weekly basis. So it does require consolidated effort from the private sector and from government, as well as the e-com platforms, to be able to stamp it out.
Okay, well, thank you very much, Paul. I'll turn it to you now, Angelia. Given your wide experience across industry, also across the region, across the globe, and your experience in trade and customs, just wanted to hear your views, your general views on why we see ASEAN as a hotbed for illicit trade, and also entering into the COVID discussion, in your opinion, how has COVID-19 changed that landscape or contributed to it?
Right. Thanks, Lena, and thanks, Christine, for putting this together. I think on addressing the question of why ASEAN is a hotbed, I think that's pre-COVID situation. We recognize that there is a gap in terms of the healthcare systems among the 10 ASEAN countries. So basically, not everyone have the access to actually get to the right healthcare systems and getting the right medication or medical care attention. And there is a vast development in all the whole ASEAN countries. So people who are, may not have the financial means to get the right treatment. Hence, there is a demand for getting the medication, getting access to cheaper drugs. And that is a perfect situation for the people who are providing this kind of falsified medications to the supply to the demand, who may be able to make a quick profit out of this. And I noticed about the what Paul was saying, that they are more nimble. In fact, they are very agile. They have very agile supply chain. They are able to actually meet the requirement and provide the drugs to the final consumer in a very sophisticated and creative ways. There is also a lack of education and information of from the consumer end, because they are unable to tell whether what they buy online or whether they are buying from reliable source or legitimate source. So that has actually add on to the elements of how there's a demand and hence there's a good supply matching them together. So on the current situation of COVID-19, our observation, basically it has shown more gaps in the healthcare system among the 10 ASEAN countries. There is a lot of areas that need to be improved. This has also shown that there is a lot of work that need to be done from the ASEAN governments to provide the basic healthcare systems and medications to their people in a legitimate ways. So I think this lesson in the COVID-19 has really shown and provide an opportunity to identify the holes and gaps in the systems. We can address about the standards later. Thanks, Nina.
Okay. I think it's quite interesting that you mentioned that the lack of education of consumers. I think we see that in so many different industries and areas. Traditionally, most people will think about, you know, the counterfeit luxury goods or things like that, but they can't even maybe comprehend that it's possible that you're actually buying a drug, medicine online or something to just take care of your health, and the people they're actually that. So I think a lot of work to be done in terms of creating awareness around that. So thank you, Ilya. I'll go back again to you, Ramesh, and then maybe now we can go into the COVID, if I can say, era right now. So how would you say COVID-19 is influencing crime differently, the economy down, and maybe focusing again in your area of expertise and how affecting and changing the trends in pharmaceutical goods? Thank you.
Okay, very relevant question. I mean, the whole world is now looking at unemployment, poverty, economics collapsing, you know, everything coming to a perpetual standstill right now. But the same cannot be said to this unscrupulous counterfeiters. For them, this is a boom town. And, you know, this is very evident because just in February or March, very recently, in fact, Europol actually seized more than about 34,000 counterfeit surgical masks. And sometime in March, the first week of March, in an Interpol-led operation, Interpol managed to pull down almost 2,000 websites that were portrayed to be selling medicines that can cure coronavirus. So, you know, and also because now everybody's suddenly talking about chloroquine. And this obviously has led to another chain reaction where Europol's operation also revealed there was an increase in unauthorized antiviral medications and anti-malarial chloroquine as well. So you see, every time that the leader says something or somebody mentions something of a specific drug, it will very quickly be counterfeited, and counterfeiters will make efforts to actually, make a quick buck out of it. But given the fact that Asia Pacific, at this time, I don't want to say that developed and developing countries, because when you say developed means you already reach a certain level. So I will just say that Asia Pacific actually has countries in the different stages of development, right? Having said that, so we cannot actually expect that the enforcement outfits be consistent throughout the region or anywhere else in the world as well. This can be attributed because of infrastructure limitation, lean resource availability, differences in technology capabilities, among many others. So this would be the challenges that the countries that are trying to develop faster would face as well. And criminal syndicates actually understand the limited communication between industries and law enforcement. They understand the challenges in countries with very porous borders as well. And they take advantage of this. At any opportunity they will take advantage of this. But Lena, you see, I wouldn't want to say about current COVID period or post-COVID period, but this is a real challenge that I would want to share with everyone who's listening in as well. At some point in time, someone will find a cure or a vaccine for COVID. Life as we know it, at some point in time, will normalize, all right? Depending what normalize is. But in reality, every year, about 250,000 to 300,000 children die because of counterfeit drugs, counterfeit medications. And regardless of how we advance in terms of COVID, the reality is that there will be many, many children, innocent lives will be lost. I wouldn't want to confine it only to children, but innocent lives will be lost. So yeah, that would be my serious take on this.
Yeah, thank you for that, Ramesh. And indeed, you're right. I mean, as Paul mentioned as well before, criminals take advantage of these kind of situations, take advantage of people who are vulnerable. They're very agile, they move very fast, and they can set up operations and be active in no time. And can you take them down, someone will pop up somewhere else. Very difficult to tackle. I'll move my next question to Patrick. So Patrick, could you explain, I mean, I know we already touched upon it by Angelia as well and Ramesh, but explain why Southeast Asia and remote areas in Southeast Asia are at high risk of receiving these falsified medicine, and maybe focus a bit more on what you as a company, what Roche is doing to prevent the infiltration of fake products in those parts of the region.
Right. Thank you. I can echo what I heard from Anjali and Ramesh. It's mainly an issue of a lack of awareness and lack of education. We're working with government authorities and NGOs to address this, which is very hard to penetrate a market like this because of illicity and stuff. So it's quite a difficult challenge and task to address, but it's very important. In terms of our own industry, the supply chains are probably deficient because you have a broad geographical scope to cover compared to urban, more developed geographies. So you have a lot of middlemen, and this is the main risk where you have the potential for counterfeit products enter the supply chain. And this is hard to tackle. So as an industry, it's not only Roche, we did a lot of activities to prevent that. For instance, some countries, we ask patients to bring back their vials before they're replenished, so they don't get a new vial, so we can control the used products, so they're not reused. Oftentimes what we see in hospitals, products are repackaged, but they're not really destroying the old package. Then people pick it up in the trash and try to reuse it. So there are a lot of ways to get into the supply chain. We try to address this. We do security audits on the supply chain as well to see how our suppliers and distributors are working. We do due diligence up front, but then the problem is as mentioned before, if it's so wide range in terms of geography, they have a lot of middlemen and sub-distributors, and it's very hard to control all of these. They have certain standards, but to break it down to the lowest level, it's very difficult. As a company itself, we do have a lot of counterfeit activities, packaging initiatives like serialization, tamper evidence on the labels, single unit coding, and so forth. They are very expensive, and it takes time to implement it on a global scale. So the way we produce products, there are in different geographies. You have the API in one market, then you get the next stage in another market, then you have packaging in the US, then you distribute it globally. So it's very complex. To have this implemented globally, it's very complex and expensive. But we, compared to, I'd say, 10, 15 years ago, we have made a huge strides already. What we see on a government level, the clearer the regulatory requirements are, the more directives and specific from the governments they are, the harder the penalties, the more impact we see. So less counterfeited products and less parallel import. What you see is it might be an original product, but maybe end of life cycle. They play around with the dates. The patient may not realize, they may think it's not harmful, but there's a huge difference if it's out of date or not. So it's quite difficult to address all of this. But the more we see of this tamper evidence and on the product level, that the actions we take, the less we see counterfeited products.
Okay, thank you very much, Patrick. Maybe just to remind everyone in the audience, please do use the Q&A function to be able to send questions, your very difficult questions, of course, to the panelists, and I'll ask them for you. So I'll turn back now again to Paul. Maybe, Paul, we've been seeing in some countries around the world that there's been prohibition on sale of alcohol in these times, in these COVID-19 times, being decided it was not an essential product, in South Africa, here in Thailand. Maybe you can elaborate a little bit for us on the negative consequences of this alcohol prohibition in some of the ASEAN states.
Sure. Yeah, thanks, Lena. Yeah, that's right. I mean, you mentioned South Africa. India is another one in our region, and indeed Thailand now, where all states in Thailand have a full prohibition on alcohol. I mean, the first thing I would say is, look, this is a global pandemic of unprecedented proportions. So the private sector and our industry absolutely supports any measures that the governments take to ensure the necessary social distancing, right? And I think the nature of our industry, it's heavily skewed towards socializing and people coming together in on-trade, nightclubs, restaurants, bars, that type of thing. So it was always going to have an impact. We understood that when we saw it first in China and then coming across the rest of this region, and now it's a similar challenge across the globe. But prohibition is something that is a policy solution that governments are taking. The rationale behind that is to limit social gatherings. And again, trying to get into the mindset of policymakers and understand and appreciate that is one thing. I think the reality here and the unintended consequences is quite another, right? So if we think of Thailand, the health implications, again, when a surge in illicit alcohol is something that will put more strain on the health system. I think what we're also trying to advocate for, and we're seeing some governments in the region taking quite progressive, either temporary or relaxing licenses for policy solutions which allow low risk economic activity to take place. So that where a bar was usually having 100, 200 people in on an evening, now they can repurpose what they do, keep people employed and do cocktails for takeout, for example. So that's a creative way that governments, and I don't know whether people on this call who are based in Singapore are getting cocktails, but it's a very creative way of keeping that low risk economic activity going, right? So that's the kind of solutions that we're looking for, because it's not necessarily Diageo or our products, it's the ecosystem that surrounds it. It's the bartenders, it's the bar, it's the hospitality and tourism sector, which is so vital for so many countries within the ASEAN region. And it's also the revenue implications, right? So these businesses keep moving, keep paying tax, and it's creating a need. It's answering a need that consumers have that would otherwise be addressed by illicit trade. Look, I think the EU-ABC, the Council, and some of the other organisations have been excellent in their engagement with governments in the region, stating that, you know, all food and beverage items should be considered essential during this time. Certainly, as we think about how our industry can support reopening when we get there, I think we'll be very deliberate and conscious about what that looks like for our industry. So it needs to be phased, right? So it could be off-trade or liquor stores, maybe it's availability through e-commerce. It certainly won't be nightclubs and bars open in the next week, 2 weeks, 3 weeks, or maybe even longer. We're seeing the UK and Australia are talking about September, October, November. It could even be that long. So I think it's about really understanding how do we do this? How do we incentivize low-risk economic activity to take place that keeps people in jobs, stimulates the kind of tourism and hospitality sector, so it is there when we do want it to bounce back and we are planning the recovery. But certainly prohibition wasn't the answer pre-COVID, and it's certainly not the answer now. But yeah, unfortunately, we are seeing some of these measures being taken. Just one other thing. What we've seen, I mean, South Africa is a good example, and I shared this with Chris the other day. South Africa has a total ban. There are 17 foodstuffs that are allowed, one of which is yeast, in order to make bread. What's actually happening is people are buying yeast in large volumes and producing it at home, right? So people are creative; they will find a way. So I think having a total prohibition is certainly not the answer. You need to have a limited availability through low-risk economic activity, so people can have access to fast-moving consumer goods.
Yeah, no, and I gave that example in my question of South Africa because I've been seeing a lot of frequently, almost every day in the media, gangs being arrested with, you know, smuggling alcohol or other sizable type of goods. So this is why I thought it was a good example. Thank you, Paul. Angelia, maybe I'll ask the next question to you. If you could maybe give us your thoughts on ASEAN's response on illicit trade in the region in the last couple of years. I know you've been working on these type of topics since I've known you for some time now on the illicit movement of goods in the region. So if you can just elaborate a little bit on that, what has been done or can be done.
Right. So I think before, let's talk about in the past where we have worked together since 2017 on the combating recommendation on combating illicit trade. We know that the ASEAN authority has not been very cohesive in responding to this. The lack of commitment is one of the key issues that we have faced. The lack of standards among 10 ASEAN countries again has kind of deter better way of tackling the illicit trade issues. Personally, I felt that the interaction with them, they know the issues. They just doesn't want to really tackle it right now, or maybe the excuse is lack of resources, lack of education, lack of funding. But with councils like EU-ABC, I think there has a lot of push to the authorities in how can you manage this in a more cohesive way. I think when we look at how ASEAN has reacted to the COVID-19, it was really clear that they did not have a very standard way of tackling the whole issue of this crisis. In addition to that, the only statement that they came out with was very recent on the 14th of April, where there was a general declaration from ASEAN making some commitment. I was looking at their commitment. I must say that it is good that that step has been taken. So which with ASEAN, I think we have to have a lot of understanding that the vast difference in the economic development, the different approach, and also the law itself, tackling the different narcotics, drugs standards are very, very different. There is an urgent need in updating them as well. So it is important going forward that for ASEAN, there should be more collaboration in terms of implementing this and tackling such issue, because from this crisis, from this pandemic, again, it has shown that because of the non-coordinated actions and restrictions of both import and export restriction by all the different ASEAN countries, it has actually disrupted the supply chain. This will actually help a lot of illicit trade to even come in now because it's opportunities for them, right? So we believe that it will be a very good chance to tell the ASEAN government that look at this outcome. If we have all this standard and if ASEAN could act in a cohesive way to put a restriction or better control over it, we will do better in terms of collecting the right duties, collecting, promoting legal trade, and then enforcing the rules and capturing, the illicit trade and stop them, especially even at manufacturing level, right? So that is my take on ASEAN.
Okay, thank you so much, Angelia. So we have a question that just came in. So before I move along with my other questions, maybe I'll just ask this one. So the question is not addressed to anyone in particular. So here, I'll just read it out. Given that most countries are in some form of lockdown, does the panel have any emerging insights how illicit trade patterns have evolved, especially for essential items such as contraband, alcohol beverage, tobacco, and medicine? So maybe I think even you, Angelia, could answer this one, but if anyone else wants to or can pass it to maybe Paul first or Angelia.
Yeah, I'm happy to have a go. So I look in terms of patterns. I guess the question is about probably cross-border movements and how illicit trade groups are operating. I think personally for me, it's a little bit too early to say the new patterns, but I can say that from an illicit trade perspective, there's even more incentive as you're restricting availability to legitimate products, right? So we'll see instances higher for sure. We've already had challenges as an industry for about 15, 16 months getting product into Indonesia, right? So there's a de facto import ban. So we see there, what's happening, right? So that's effectively a prohibition on imported spirits. And again, we touched upon, I mentioned oplosan. That's the local production of methanol plus mosquito coil plus brake fluid plus all these terrible things, right? I don't think it's a straight shot between premium alcohol and that, but what I'm saying is if you're not letting alcohol in, people will find a way to get it. So we've already got extremely high instances within the region because of some of the infrastructure, regulatory environment, and high taxation system. My worry is that because of the restrictions during COVID, it will increase those instances still further.
Yeah, of course. Maybe Patrick, you have something to add on this one, on the medicine side?
I think we said already before, I don't see a lot of patterns coming out of COVID, probably more after COVID. If we get to a new normal, we'll see probably more how the counterfeit industry is taking advantage of what they learned. So I think right now it's probably still too early to see a trend, particularly for the prescription drugs. So OTC, I think probably the same thing, maybe accelerate, probably more in a few months from now. Probably Ramesh, you have more insight.
Yeah, it looks like Ramesh.
Yeah, just to add on my 2 cents worth. Yeah, I think the question is very pointed, but I think asking this question, we have to look into the broader perspective of the question. We have to understand the fact that the COVID period does not promote illicit products to come in. Illicit products and the smuggling and the trafficking has always been there. The COVID period now expedites this situation because there is a need, an urgent demand for test kits, COVID test kits, surgical masks, medicines that contain chloroquine as well. So that would be the immediate pattern. But like what Patrick mentioned and Paul mentioned as well, the post-COVID period would see the real demand for these products, and whatever that is in demand will therefore be counterfeited. That would be the actual trend to understand.
Okay, so maybe you can stay there, Ramesh, because there's another question coming in. I think it's quite relevant for you, not only given your current role, but your previous role as well. So one of our guests is asking if there's a risk of counterfeit medical products infiltrating the legal supply chain of Singapore. So it's a healthcare worker who was worried about it being given to it's her or his patients, and what kind of a role can the healthcare system take to avoid that?
Okay, very good question. But the question shouldn't only again be confined to Singapore. Anyone who takes counterfeit or substandard medication, there is a possibility for them to suffer some consequences out of it, and the maximum being death, right? But if you were to ask about Singapore itself, because I think Singapore, like other who's very advanced in the stages of development, like Japan and Korea as well, the supply chain and the regulatory efforts that is undertaken here is very robust. There's been almost zero instances where counterfeit medications have been found in the legal supply chain. But that cannot be said for the when somebody buys from dubious sources. So the question is, if it can come into our hospitals and polyclinics and GPs, the answer is no. It is very, very difficult. But if it does come in, I think then it's a role, but we have to really seriously look into the issues here. But having said that, I think this problem would be a more relevant question for countries that are in the lower spectrum of development, where pharmacies, fly-by-night pharmacies can just pop up as well. And the unlicensed pharmacists dispensing medications, like what was it, Patrick, who mentioned, we have come across cases where, oncology, cancer medications were seized and tested and found to contain sewage water as well. Breast cancer medication that was found seized, tested to contain chalk powder and bamboo ash. So, these are real issues that's not only confined to Singapore, but to everyone else as well. So just buy from legal sources and not from dubious ones. That's how I would say it.
Okay, thank you very much, Ramesh. So there's another question here, which is less specific on illicit trade, but I think this would be a great one for you, Angelia. So a question came in asking if the global supply chain, and most particularly in the healthcare sector, will be, in your opinion, diversified from China in the next couple of years, and that could benefit manufacturing opportunities in the ASEAN region. If you have any insights on that one.
I'll try to answer this. I think I think we can also ask Patrick later, but we do see some of the pharmaceutical companies start producing in ASEAN countries. Of course, there were good economic reasons to produce in ASEAN countries. Diversifying the supply chain has been a big lesson learned through this recent pandemic issue, and also the China-US trade war. So we are seeing diversification from China in production in all sectors. I would say that it includes the pharmaceutical manufacturing sector. So that will also mean that we can have more legitimate supply from ASEAN. But the issue is not these legitimate supplies, but how the counterfeiters are getting their illegal supplies and providing them and putting them into the normal supply chain. And because of the less aware or less informed consumers, hence, there is a demand, or they may have mistakenly bought something that they couldn't even tell that it was illegal drugs. So it would be a lot of coordination within the different departments in all the ASEAN governments to ensure that the ASEAN standard in IP protection, brand owners collaboration, public-private collaboration is very important right now. And it should not be individual countries in ASEAN, but on an ASEAN level, a standard framework to work with the public-private sectors to identify what is real, what is not, so that healthcare workers, consumers, activities can be initiated to inform the consumers how to ensure that you do not buy from illegal sources. And I think we have also noticed that apart from the manufacturing facilities, there's a lot of free trade zones in the ASEAN countries. This has been identified as one of the area where a lot of activities can take place in the FTZ. Mm-hmm. So if we could have improved the governance in these FTZ zones, we believe that it would really help in stamping out these illegal supply chain and making sure that only the right legitimate trade are being facilitated, making it more difficult. I think if we increase more barriers to the traffickers and making it more difficult for them, then I think it could actually help improve the situation in ASEAN. All right, Dina.
Yeah, thank you very much, Andrea, and thank you for mentioning that was one of my hidden extra question for you on the free trade zone. So you did, that's great. There's another question that just came in asking about e-commerce and that there are many listings of prescribed medicine, counterfeit or not, which can be easily purchased by customers online. So what is the best action that can be taken by manufacturers to ensure the safety of the products? I think in this particular case, it can be answered as well by Paul, what he was mentioning before, how Diageo is working with online platforms and also working with the different partners to tackle these issues. But maybe Patrick, you'd have something to add on to that part, that question.
I would add to what Ramesh said. If it's online, it's not an official source, there's most likely something wrong with it. If the price is low, too nice to be true, leave your hands. If you have to pay in Bitcoins, don't do it. Online sources, not from the official sources, there's definitely something wrong. Either it's counterfeited, in the best case, probably original product, but outdated. So just don't touch it. We do work with law enforcement, which are usually, they have a few, Ramesh, you know better, a few times per year, coordinate activities globally where they crack down on counterfeiters. So we work with them in these activities to support the information we have, which we gather over the year. But again, they're very nimble. They move quickly from one platform to the other. They change names. It's very hard to contain.
Okay, thank you very much, Patrick. Maybe I know that there's going to be PM Lee's going to do an address at 5 p.m. So we may lose some people by then. So we'll try and maybe shorten up a little bit. But I still have a question I wanted to ask to all of the panelists, if you wish. It's to kind of highlight how ASEAN leaders can work with businesses and local societies to prevent illicit trade. So we hear from each of you maybe 2 or 3 recommendations, or see it as a wish list. What would you like to see? So we can start again the same order.
Okay, all right. Thanks. So all right. So I mean, this COVID period, what it saw is what it shows us is that even among ASEAN countries, we are not coordinated in our actions. I mean, borders were shut quite independently without even any discussion between ASEAN countries. Everybody was in self-preservation mode, but we can't blame them because it's very difficult to consult such initiatives with neighbors, and as you know it, neighbors are never without issues. So that would be very, very crucial. But these are very unprecedented times, and of course COVID is a very global pandemic as well. But while we are managing this, I think we have to have our eyes in the future and how we're going to manage the post-COVID as well. So the 3 points that I would want to say in this instance would be cooperation. This is echoing Angela. Collaboration and community policy. This would be 3 main ways that I think ASEAN countries can come together. Collaboration would be like working together to create something new in support of a shared vision. But we have something like that as an ASEAN directive, but that is like a time-tested mode. We always take 2 steps back and 3 steps back again. So it's very hard for us to move forward. And cooperation in terms of importance of creating a good network between associations and law enforcement, and even between ministries and trade developments as well. And of course, community policing would be developing partnerships among ASEAN countries with a common objective. And I think that this engagements should be actually very direct, very engaged, and very collaborative between the various organizations, the voice of the industries, panelists here as well, and the different law enforcement and different ministries and different governments. In order to make sure that everybody has the time to speak. Yeah, I would end my thoughts here.
Okay, to you the same question, Patrick. What would you like to see in terms of what recommendation would you give to ASEAN?
Well, I couldn't agree more with what Ramesh said. Like the collaboration across stakeholders is very important. If I had, I have a whole list of issues I could address. Just focus on a few, maybe a sincere enforcement of the laws and regulations, some more serious punishments, maybe a permanent debarment of pharmacists who are involved in this illicit trade. Maybe on a higher level, ensure availability and access to drugs, healthcare coverage, insurance coverage, helping reduce demand online by providing access to medications. So it all starts, what's the source, what's the reason? Patients can't get access to the drugs they want, they need, so they try other ways, similar to a policy with the alcohol. If there's a need, people will find ways. Raising the awareness, helping to simplify and control supply chains, work with customs experts and educate them more. So like the whole package, but if it's only done by one part, it's not going to be effective. So everybody has a role in this.
Yeah, thank you, Patrick. Paul, to you.
Yeah, I mean, I would agree with a lot of what Ramesh and Patrick talked about in terms of collaboration and enforcement. The other thing I would say, and certain industries are good at this, data, understanding the size of the prize here, right? How can we convince governments to take action, right? So I'll give you an example in Vietnam where we undertook quite a comprehensive study of the unrecorded alcohol market, right? Where our findings suggested that 72% of total consumption in the country was unrecorded, right? So that's non-tax paid. We presented this to the government, and I guess my challenge here is be targeted in your response. When we presented it to government, they said, wow, there's more consumption happening than we thought, we need to regulate. So what was the response? Regulate the 28% that's already highly regulated, that's creating the 72% of unrecorded. So it's really getting the right data and making targeted responses. So what could a targeted response look like in Vietnam, right? A lot of this is community or village alcohol, right? These communities aren't necessarily trying to sell at a scale like a Diageo might be. They're also not necessarily trying to cause harm or make products that are injurious to health. So why can't bigger companies like Diageo, like our industry, play a role in helping to bring them into the regulation, if not the tax-paid system, so that these community, village alcohol and these techniques that have been part of culture for a long time continue to thrive, but are produced under world-class kind of production techniques and facilities and circumstances. So that's one way. And of course, then it's a lot of the same things that Ramesh and Patrick said, communication, collaboration, really articulating to people, you know, it's that, okay, maybe I shouldn't buy this because it looks like it's too cheap, or it looks like an unreliable online source. And invariably, it will have health implications. So I think that's all I would add, but otherwise fully concur with what Ramesh and Patrick have said.
Thank you, Paul. I don't know, Angelina, if you have as well.
Yep. Yeah, a very quick one. I think setting up a public-private partnership on an ASEAN group level, working group, would be really, really helpful for all ASEAN to set the standards and to work with the brand owners, because it's only the brand owners who knows how to identify what are the illicit trade and providing data. So the other area is digitization. I think ASEAN, if they could embark on a standard on digitization, sharing of data would be excellent. And last but not least, I think imposition of the IPR protections into the authorized economic operator framework that ASEAN is adopting, that would really help stem out, you know, the facilitate the legal trade and, you know, prevent others from going through the borders with their illicit source. So these are my recommendations.
Awesome. Thank you so much, Angelia. So I think a few of the things that I've noticed from this very interesting discussion is obviously something we know very well is that ASEAN is an extremely complex and diversified region, and that it's very complex routes for movement of goods as well. We've seen a lot of panels talking about a lack in general of awareness, a lack of education from the consumers. And also it's really, and Angelia was mentioning right before that all of this, the situation right now shows that there's real gaps in the current healthcare systems across the region. Lack of standards in ASEAN, lack of coordination, a need for more digitalization, go paperless, right? Of course, an improvement in governance in free trade zones to make it harder for illicit traders to take advantage of maybe the lack of insights in those regions. We heard a bit, we talked with Paul about prohibition, that prohibiting products could actually just incentivize smuggling counterfeiters to go out there and bring products. And they can very quickly fill the void when the products are missing, the consumers want to have access to. That we see that criminal organizations will always find the means to supply the market, right? With cheaper, undeclared counterfeit products in medicine and all sorts of other areas. When we talk about taxable goods, again, in the prohibition side, it will just increase, unlawful sales of these products and not paying the applicable taxes, which would contribute to reduction in tax revenue for governments, and also put pressure on national budgets. And one thing we've heard a lot across the conversation here is public-private partnerships, more interaction between the private sector and governments. I mean, we're going to see moving forward a lot of repercussions from this situation. And it's really right now that we need the private sector to be able to work with governments. So maybe just to close off, I'll ask my last question to a non-panelist. I'll address my last question to Chris from the council. So Chris, thank you so much. In the last couple of years, I mean, the council yourself, you've really been helpful to support businesses to be able to interact with ASEAN officials. You've organized a number of business missions, of meetings at the highest levels, may it be on a ASEAN level with meetings like the finance minister meetings, DG customs meetings, and so on. And unfortunately, like many other big global events, things have been canceled this year, have been postponed this year. So maybe the last question I'd like to ask to you is how would you kind of see the way forward for companies like mine, like ours here, some of us on the panel, to continue to be able to engage in a really meaningful way with ASEAN officials, and how can the council support us on that? And after, I'll allow you to give also the closing remarks to this webinar. Thanks, Chris. I hope you're still there.
So yeah, thanks, Lena. Thanks, Angelia, Paul, Patrick, and Ramesh as well. It's a very interesting discussion. Before I answer Lena's question, I'll just pick up on the last point about the recommendations. We've been trying to work with customs authorities in particular across the region on the very topics you were talking about, and it is a bit like pushing water uphill with many of the customs authorities across ASEAN, but we'll keep plugging away at them. I think there is a lot more need for around collaboration, cooperation, information sharing between the public and private sectors and on all of these issues. Yes, the council has done a lot of work over the years in terms of engagement with ASEAN at working level in different working groups, ministerial working groups, and then again at individual country level as well. And actually, we're not stopping doing that. We've been, as Paul mentioned earlier, we've been writing letters, particularly around support for keeping open supply chains for essential services, for medicines, for food and beverages, and agricultural products as well. We've written to the economic ministers, finance ministers, health ministers, and with other organisations also to ASEAN leaders on these topics. And indeed, some of the stuff we've worked on was then fed into the G20 trade ministers discussion towards the end of March. And you can see some of the language in their statement was pulled from a letter that we wrote to people in ASEAN. So we are continuing that engagement. And in fact, I'll be having the joy of spending next Sunday on a video conference call with ASEAN trade officials for the day, because ASEAN has suddenly got into the 21st century and worked out that video calls can happen. So I think a lot of work will be continuing on that front, and we'll keep pushing hard. And hopefully at some point later in the year, we can actually start to go and meet people face to face again. So we still need to keep the ground prepped in line for that going forward. So I think with those comments, I'll put it again. Thanks, Lena. Thanks to all of the panel. Very enjoyable discussion. and I think we should bring this to an end now. But thank you, everybody, and everyone on the call. Thanks for joining us. And in the meantime, I think keep safe and stay at home as well. Thank you very much.
Thank you, Chris. Thank you all, everybody.
Thank you, everybody.
Bye.
Thank you.